This is a critical appraisal of varenicline and counseling for vaping cessation, presented by Maureen Uchegbu, Latoya Morgan, and Miranda Jovic. From a clinical perspective, the study aimed at evaluating the effectiveness of varenicline, a smoking cessation drug, in aiding vaping cessation. The participants are individuals addicted to electronic cigarettes seeking support to quit. Hence, the study aims to determine if varenicline increases vaping abstinence rates compared to placebo groups. A holistic view of the article shows that this randomized controlled trial was conducted to assess the success of varenicline in vaping cessation, and the study examines the continuous abstinence rate and compares results between varenicline users and a placebo group. In addition, the adverse effects and long-term abstinence were evaluated to determine clinical effectiveness. The CASP cohort study checklist was used for the clinical appraisal of this study. In Section A of the checklist, we agreed that the results of the study were valid and it addressed a clearly focused issue. The cohort recruited in an acceptable way. They were accurately measured to minimize bias. Abstinence was measured using self-reports. Confounding factors were identified. 113 participants completed the treatment phase, which was 12 weeks, and 95 completed the follow-up phase, which was 24 weeks. And yes, the follow-up was long enough. To prove the validity of the results, we found out that the research focused on a clearly defined issue. And that issue is, can varenicline improve vaping cessation rates? Secondly, the study design ensured reliability using randomization, blinding, and placebo control. Lastly, participants were selected based on clear inclusion and exclusion criteria. Methods and study design used are double-blind and placebo-controlled randomized trial. Here, participants were randomly assigned to varenicline or placebo. The duration of the study was 24 weeks. The use of combination therapy was used, and this entailed counseling alongside with medication to assess its impact.
Slide is about measures used. Section A, measures used, is about primary and secondary outcomes. The primary outcome is continuous abstinence rate, which is the CAR at weeks 4 to 12 and 4 to 24. Secondary outcomes is adverse effects, withdrawal symptoms, and overall quit rates. These are validated through assessment tools, which were used to track progress and confirm vaping cessation. Section A, data analysis. Statistical methods, logistic regression was used to compare abstinence rates. Odds ratio, OR, and confidence intervals, CI, were reported to ensure statistical reliability. The p-values were used to determine significance, ensuring results were not due to chance. Section A, we consider potential biases that may affect the validity of the study. First, selection bias was minimized through the use of randomized design. This approach helps ensure a fair distribution of participants across groups, improving the reliability of the findings. Next, performance bias was reduced by implementing a double blinding process. This means that both the researchers and the participants were unaware of the group assignments, which helps prevent any unintentional influence on the results. This method is supported by findings from Hughes and colleagues in 2019. Finally, reporting biases was taken into account. Since abstinence was self-reported by participants, there's a possibility of recall bias, which could affect the accuracy of the data. Recognizing this helps us interpret the results with appropriate caution. In Section B, we look at the results and the size of the treatment effect. From weeks 4 to 12, the continuous abstinence rate, or CAR, was 40% in the varenicline group compared to 20% in the placebo group. This difference was statistically significant with a p-value of 0.011. Extending the observation to weeks 4 through 24, the CAR remained higher in the varenicline group at 34.3%, while the placebo group had a CAR of 17.2%. Again, this was statistically significant with a p-value of 0.022, as reported by Ibert and colleagues in 2020. These findings suggested that varenicline has a significant treatment effect in supporting smoking cessation. Now, looking at the precision of the treatment effect, the odds ratio for varicilin's success was 2.67 with a 95% confidence interval ranging from 1.25 to 5.68. This indicates that individuals taking varicillin were more than twice as likely to succeed compared to those on placebo, with the confidence interval not crossing 1, which suggests clear effectiveness. Additionally, the p-values for the results were below 0.05, which confirms statistical significance and suggests that the observed effect is not due to random chance. Overall, these findings are considered precise and robust, supporting the conclusion that varicillin is effective for smoking cessation. If we are asking if the results are believable, we believe that the answer is yes. The study was well designed, utilizing a randomized controlled trial methodology, which is considered the gold standard for minimizing bias. In addition, the findings are consistent with the previous research on smoking cessation using varicillin, such as the work by Cahill and colleagues in 2016. This adds further credibility to the results. Finally, adverse effects were actively monitored throughout the study, indicating that safety was taken seriously and appropriately addressed. In Section C, we assess whether the results are locally applicable and useful in practice. First, can the results be applied to the local population? We answered yes. The study population closely resembles those typically seen in smoking cessation clinics. Since varicillin is FDA approved and widely available, it's a practical option for local vaping cessation efforts. Second, do the results fit with other available evidence? Yes. The findings are consistent with previous nicotine replacement therapy studies, reinforcing the role of varicillin in supporting vaping cessation. Lastly, what are the implications for practice? The study offers strong evidence that varicillin, especially when combined with support, significantly improves vaping cessation rates. This supports its inclusion in clinical guidelines for vaping cessation programs. This slide and/or section considers how the results can be applied locally. Yes, the findings are relevant to smoking cessation clinics and primary care settings where similar populations are commonly treated. Varicillin is already FDA approved and is widely available for use in vaping cessation, making it a practical choice for implementation. This is supported by West and colleagues in 2018. However, additional research may be necessary to explore its effectiveness across more diverse populations, ensuring broader acceptability. In this slide, we evaluate how well the results align with existing evidence. The findings are consistent with previous research on nicotine replacement therapies and behavioral interventions as shown in STED ETL 2021. Varicillin's proven success in helping individuals quit smoking further supports its role in aiding vaping cessation. Overall, this study contributes meaningful data that can inform broader efforts in tobacco and e-cigarette control. Responding to the patient, we can confidently say that varicillin doubles the chances of quitting vaping compared to using no medication at all. While mild side effects such as nausea or vivid dreams can occur, they are generally short-lived and manageable. As noted by Jordan B. and colleagues in 2021, most importantly, combining varicillin with counseling significantly improves the chances of success. This approach provides both pharmacological and behavioral support, giving patients the best opportunity to quit. Thank you for your attention. That concludes our presentation. We are happy to answer any questions you may have.